Today I'm going to be talking about the metabolic body system and talking about the changes that happen in the gerontologic population in this part of the body. The metabolic system also is known as the endocrine system, and this system is one that consists of organs and tissues that produce hormones in our bodies. And so the hypothalamus in the brain acts as the control center for all of these hormones. And these hormones are specific to the target organs that they are programmed, so to speak, in our bodies for. So different organs like the thyroid, the pituitary gland, the thymus, the pancreas, adrenal glands, and the reproductive organs all have very specific hormones that apply to them and them only. Now, there are many changes that are associated with aging that have to do with the metabolism. So some things that happen when our bodies get older is one thing, the pituitary gland gradually becomes smaller. So around age 20 to 30, the pituitary gland starts to decrease in size year after year. The metabolism also slows over time. What this means is that carbohydrates and glucose in the body are utilized at a much less efficient rate in the body. Also, parathyroid hormone levels are elevated and cause increased osteoporosis. So a lot of times what you will see in older adults is that they have really brittle bones or they're really predisposed to fractures. And a lot of this has to do with the hormone changes that happen in the body, especially for the older women population once menopause is reached. The body also becomes less sensitive to insulin around age 50. Our bodies start to break down glucose in a less efficient way, and also a lot of times insulin is not being used as efficiently. Hormones will be produced less or secreted at a slower rate, and they take more time to be broken down. Some of these hormones that decrease would be aldosterone, the sex hormones like testosterone and estrogen, calcitonin, growth hormone, I mentioned parathyroid hormone, as well as insulin. There are many age-related changes that also have a lot to do with nutrition. And a lot of people don't think that nutrition is as important as it is, but especially for the older population, it's really critical to make sure that there is adequate nutrition, because a lot of the times there can even be malnutrition, which can either be over the amount of nutrients needed, or a lot of times that's associated with being under the amount needed each day, so they're not getting enough. Or it can be specifically related to a certain nutrient. So some changes that can happen because of nutrition would be a lack of physical activity, poor appetite, maybe they've lost taste buds, feelings of unwantedness, and a sense of neglect. A lot of people don't want to eat as much when they're older because food just doesn't taste the same, or they might have lost their spouse and so they're not getting to eat meals with them anymore. Many times what happens is there will be a loss of lean muscle in the body, and that can look like a lot of different things, but oftentimes you can see older people, they look like they might be wasting a little bit, or they are not able to perform like they used to. There's also a decrease in secretions in the stomach and also decrease in saliva, which can also make it more difficult to eat. And then slowed peristalsis in the stomach, so that just means slow digestion, which can often lead to constipation. We constantly hear about the elderly dealing with constipation. It can also cause a weakened immune system, and that can lead to things like falls and fractures and orthostatic hypertension, simply because they are not feeling well, and if they stand up to get up, they can have falls and issues with that as well. Next, we will look at assessment changes associated with older adults. Now we're going to talk about some of the assessment changes that happen in the metabolic system. So when looking at the metabolic system, you will be assessing things like their thyroid levels, their insulin, their hemoglobin A1C levels, and looking at the different hormones of the body. It's common to find normal amounts of subcutaneous fat on anyone who's an adult. Say they're in college or they're in their 30s. It's normal to have a normal amount of fat under the skin. In older adults, some of the changes that will happen is that there will be a decrease in that subcutaneous fat, but an increase in the visceral fat in the body. And what that means is that fat under the skin becomes thinner and thinner, and so you kind of can see the skin become more wrinkled and look like it's just barely covering the bones. But there's an increase in visceral fat. And visceral fat is what is found in the abdomen, around the organs, and that is something that leads to insulin resistance in the body. So the decrease in subcutaneous fat causes the skin to become more fragile. So in nursing, we often talk about when we are taking care of the elderly, we have to be really careful with their skin. Even something as simple as turning a patient over could cause a skin tear, and they're also more at risk for bleeding. There's also increased frailty and reduced mobility from the loss of muscle tissue. So in a normal assessment, you would find that there's adequate lean muscle in the body, but over time, the body starts to have a loss of muscle mass, and that can lead to a lower bone density because you can't be as weight-bearing, and so that can often lead to osteoporosis and being predisposed to fractures and stuff like that. There are also changes in the thyroid levels, and this is very common among the elderly population to have low thyroid function or hypothyroidism. That is more common, and especially among women, this seems to be a problem. And along with the osteoporosis, you'll start to see a curved spine. People can become bow-legged, but that loss of the bone density causes the spine, the spongy bone, to start to be more compact. Metabolic disease processes. The most common disease processes having to do with the metabolic system are thyroid disturbances like hyperthyroidism and hypothyroidism, as well as insulin resistance and diabetes, with type 1 and type 2 diabetes. Thyroid disease is one of the most common ways that the body is affected by an aging metabolism. Hypothyroidism is the failure of the thyroid to produce enough thyroxine hormone. So often people will feel palpitations, weakness, heat intolerance. They'll be confused. Also, there will be, in their lab work, elevated TSA values and low T4 values because the pituitary is having to work overtime to compensate for the body's lack of secretion. It affects 5% of Americans, and it's really surprising to see the numbers of women affected by hypothyroidism. Oftentimes, they'll be treated with something called levothyroxine, which will stabilize their thyroid levels. One thing that is really important for the nurse to educate the patient about is that it must be taken at the same time every day for the rest of their life. And lower doses for adults are common with any medication, but especially with something like a thyroid medication, which could be really sensitive in the older population. Hyperthyroidism is the excessive secretion of thyroxine hormone in the body. It's often a sudden onset, and people will feel symptoms of AFib, constipation, tremors, weight loss, and they will have low TSA values but very high T4 values. They can also feel anorexia and constipation and weight loss and depression, and it also increases the speed of bone loss. There are several complications that can result from thyroid disease, especially in the elderly, because their bodies are so sensitive. Myxedema coma is when untreated hypothyroidism happens in the elderly, and even when it's discovered, treatment plans that are the best can still cause patients to die because medication for thyroids cannot be given rapidly for risk of drug toxicity, and so a lot of times the treatment just is not adequate to treat the coma. There's also an increased risk for AFib, worsening of angina, especially if someone has heart failure. You're also at a predisposed risk for congestive heart failure if you have thyroid issues. And so it's really important to educate patients not only about medications, but also about the seriousness of what they are dealing with. Often patients with thyroid disease are misdiagnosed, and so one of the jobs of the nurse is really to watch for symptoms like anxiety, dementia, depression, AFib, and seeing if those could possibly be thyroid disturbances and not a different diagnosis. It's really important to instruct patients to adhere strictly to their medications. They can never miss a dose, and also to teach them correct self-administration of medications and how to monitor their blood levels and then the signs and symptoms of any worsening of their disease. It's important for patients to take the same brand of the medication at the same time every day and not to take any additional vitamin supplements when taking the medication. Diabetes is when the body is unable to use glucose that is produced and ingested, resulting in hyperglycemia in the body. Studies show that 26.9% of people over the age of 65 have diabetes, and 90% of them have type 2 diabetes. There's two types, type 1 and type 2, but there's also gestational diabetes and steroid-induced diabetes. But gestational diabetes only has to do with mothers who are pregnant, and then steroid-induced can also be caused by something like taking an inhaler for COPD. Type 1 is insulin-dependent or juvenile onset diabetes. The beta cells in the pancreas are destroyed and the body cannot make enough to compensate. Type 2 is adult onset diabetes, often caused by an elevated BMI. Age alone, however, can be a risk factor, and it's why you can see an increase in the gerontologic population. The pancreas is able to make insulin, but it doesn't make enough to keep up with what the body needs. Symptoms don't show often until there is significant damage that has already occurred in organs, so it's important to have annual screens for diabetes. Older adults have a harder time metabolizing proteins and lipids in the body, and that can lead to an increased incidence of diabetes. It's important to have something like your A1C levels checked regularly to see if you are experiencing possible signs of prediabetes. Some signs and symptoms of diabetes are polyuria and polydipsia, so excessive urination and thirst because your body is trying to dilute the glucose in your blood that's not getting used by your cells. Dehydration, confusion, delirium, and incontinence, as well as recurrent infections, especially for women, UTIs are very common. Fatigue, nausea, delayed wound healing, and weakness are all signs that diabetes has probably been present for a while in the body. Some of the complications would be heart disease, stroke, neuropathy in the peripherals, periodontal disease, end-stage renal failure, and blindness, especially if you're over age 65. Diabetes makes you 2 to 4 more times likely to have a stroke or heart disease, and so it's really important that these things can be caught early. Two of the main things that nurses can do is to encourage patients to control their blood sugar and to reduce the risk for complications. Nurses should pay attention to symptoms of hyperglycemia, hypoglycemia, talking about patients' weight and nutrition and exercise history with them to see if there's any changes that can be made. Assessing the patient's financial ability to manage the disease process. A lot of times people cannot afford their insulin and need help. Tobacco and alcohol use can increase risk for cardiovascular disease. Blood pressure, vision changes, and neurological function are important for diabetes as well. One of the main things to monitor is a hemoglobin A1C level, which is showing the blood glucose level over the last 90 days. For those who are medically fragile, it's really important to focus on their quality of life, monitoring symptoms, and promoting early screening in different communities. It's also important to promote healthy eating, dieting with protein, low carbs, exercise, and maintaining their blood pressure and cholesterol can really reduce the complications of diabetes. Giving adequate education about smoking cessation, keeping their blood pressure lower than 130/80, keeping your cholesterol below 200, blood glucose levels that should be below 126 when fasting, and also encouraging annual screens for older adults and talking to their healthcare providers about what they can do to promote a healthy lifestyle. One of the most encouraging things you can do for a patient is to give them the adequate resources that they need to feel like they can manage the disease themselves, and it really promotes their quality of life.